Well, the US government has issued a recommendation that almost all US citizens get annual coronavirus vaccine shots. The advice comes as US hospitalizations for coronavirus are on the increase. Vaccine shots for children as young as 6 months have been approved by the US Food and Drug Administration. Hundreds of deaths due to coronavirus are recorded each week in the US. A campaign to encourage people to get vaccinated is due to begin in a few days. Let's bring in epidemiologist and co-founder of the World Health Network, Dr. Eric Feigl-Ding. Welcome to DW, Doctor. Many of us thought the pandemic was over. Why is the US recommending that Americans get shots every year now?
Well, we wish it's over, but clearly the data shows that it's not. We're not just talking about mild cases. We're talking about, for example, deaths in the US have doubled, hospitalizations have tripled, and ER visits have quadrupled in the past month and a half. And so we're in the beginning of another wave. And right now, the variants that we have are very highly evolved and different than previous waves. This is why reinfections are at all-time high as well. So these are very evasive, and they are clearly sending people to the hospital. It's not just a mild. And even then, we know that mild has long-term consequences. That's why the CDC has recommended these new boosters that they've been testing all year for the general population. And it even shows there's benefits for children, not just the elderly. So this is why they recommend it for everyone 6 months or older.
And you talked about a doubling and quadrupling of hospitalizations and the number of cases. Perhaps you could put some figures on it. How many cases, how many hospitalizations are you seeing?
So cases are really hard to measure because not much testing. But hospitalizations, it has tripled across the U.S. and in parts of New York it has actually more than 5x'd. So I think, it is lower than, of course, during 2020 and 2021. But I think people need to understand that, despite it being lower, these numbers are still overcrowding hospitals. And, we might be about a quarter like where we were like last winter. But in terms of the Delta variant, we were actually about the same level of hospitalization as the Delta variant across the U.S. So it's still quite a lot. And I think people underappreciate that. And unless you're in the hospital, you're out in the restaurants and shopping malls, it's out of sight, out of mind. You don't see all this. But it is definitely happening. And the boosters do work. These updated boosters do work against the new current variants.
Right. And so we should regard COVID now as embedded, if I can use that term. It's with us to stay, and we should protect ourselves against it as we do, for instance, the flu.
Well, I don't think we should accept it. First of all, we have conquered the flu in the past in certain years that's much worse than others. And, should we accept HIV and AIDS as, it's embedded, it's endemic? No, we're trying to eliminate that and long-term using strategies. And I think embedded, we shouldn't just have a laissez-faire attitude. Besides boosters, I think the best thing, which is even less requiring of people compliance, is have clean indoor air. I think we should assume that these respiratory viruses will come back, but take the precautions because this COVID is not just another sniffle. It has long-term damage. 1 in 4 people, survivors, have suffered long-term lung damage, as well, even 1 year afterwards. And I think it also raises the heart attack and cardiovascular, stroke, and diabetes risk long-term as well. So we shouldn't just accept it. We need to mitigate it. I think besides boosters, we also need clean indoor air. Don't just accept it as like, come what may. I think we need to rethink our entire schools and workplaces to basically prevent future airborne transmission.
And these significant increases that you talked about, should we see this as a peculiarly American phenomenon, or should other countries be making the same recommendations to their populations?
Yeah, well, the hospitalizations, we're seeing it across many places. And I don't think it's uniquely American in any way. But I do hope other countries take heed of the CDC recommendations to recommend for everyone over the age of 6 months. Because I've seen UK and Australia only recommend it for those 75 plus, 65 plus. And I think that's way too elderly in terms of too restrictive. We need it abroad across young people. And the CDC yesterday did a cost-benefit analysis. And the cost-benefit analysis clearly show it has benefits for everyone, including children. So I think the countries that are ignoring recommendations for children, I think they're making a grave mistake.
But we did see how political the vaccination issue became in the US, even as people were dying in their millions. Now that COVID's no longer news, are doctors like yourself going to face an uphill battle at getting people to get those booster shots?
Well, just because something is an uphill battle does not mean you shouldn't do it. That's not, sometimes we go to the moon because we really there is important work to be done. And COVID, even if only 1 in 5, 1 in 4 people get vaccinated, that will save a lot of lives, a lot of hospitalization, a lot of long-term comorbidities in terms of lung damage, heart attacks, strokes. And I also want to remind people, like, for example, in the UK, the number of people out of work because they're too sick to be in the workforce, this is government data, has increased to 50%, and it's actually a main contributor to the economic stagnation. So I want people to think that this is also not only for health, but also for the economy, that we need to get people back to work healthy. In a healthy society is what we want, not just complacency. And I think vaccines is just the start. I think it's very important that we get the new boosters, but also we need better, clean indoor air, HEPA filters, ventilation, upper room UV to truly prevent many other diseases, including COVID, but also RSV, flu, and many other future pandemics.
Good talking to you. Thank you so much for joining us, epidemiologist Eric Feigl-Ding from the World Health Network. Thank you so much.
Thank you.